I'm Cathy with Level Up RN. In this video, I will be discussing neuromuscular blocking agents. And at the end of the video, I'm going to give you guys a little quiz to test your understanding of some of the key facts from the video. So be sure to stay for that. And if you have our Level Up RN Pharmacology flashcards, go ahead and pull out your flashcard on neuromuscular blocking agents so you can follow along with me and pay close attention to the bold red text on the back of the card, because those are the things that you are likely to get tested on. Neuromuscular blocking agents are medications that temporarily paralyze skeletal muscles and prevent movement during surgery and intubation procedures. Some common neuromuscular blocking agents include succinylcholine, pancuronium, and rocuronium. Pancuronium and rocuronium work by binding to acetylcholine receptors at the neuromuscular junction. This prevents acetylcholine from binding to those receptors and triggering muscle contractions, and this in turn leads to muscle paralysis. Succinylcholine works a little differently than pancuronium and rocuronium. It also binds to acetylcholine receptors at the neuromuscular junction. But in doing so, it causes a brief period of depolarization and muscle contractions, followed by muscle paralysis. So to be clear, all three medications bind to acetylcholine receptors and eventually cause muscle paralysis. A key side effect of neuromuscular blocking agents is respiratory arrest. This is because these medications also paralyze respiratory muscles, which are responsible for breathing. Therefore, when administering a neuromuscular blocking agent, the patient's airway must be secured and mechanical ventilation must be immediately available. In addition, succinylcholine can also cause muscle pain after surgery. This is because succinylcholine causes a brief period of muscle contractions before muscle paralysis occurs. Another potential adverse effect of neuromuscular blocking agents, particularly succinylcholine, is something called malignant hyperthermia. Malignant hyperthermia is a rare and life-threatening complication that can occur when individuals with a certain gene mutation are exposed to specific anesthetic medications. Key symptoms of malignant hyperthermia include a high fever and muscle rigidity. If a patient experiences malignant hyperthermia during surgery, then the anesthetic agent that is triggering this reaction should be immediately discontinued, and dantrolene, which is a skeletal muscle relaxant, should be administered. The patient should also be provided oxygen and cooling measures such as ice packs and cooling blankets. And lastly, it's important to note that succinylcholine carries a black box warning due to the risk for cardiac arrest from hyperkalemic rhabodmyolysis. So let's talk about what this means and why it can occur. So as I mentioned before, succinylcholine will briefly depolarize the muscle before causing muscle paralysis. However, in some patients, succinylcholine will cause massive depolarization of the muscle, which leads to rhabdomyolysis or breakdown of the muscle tissue. When the muscle breaks down, this releases huge amounts of potassium into the bloodstream, causing hyperkalemia. And hyperkalemia can trigger cardiac dysrhythmias and lead to cardiac arrest. All right, it's quiz time. Are you guys ready? I've got 3 questions for you. Question number 1. Neuromuscular blocking agents prevent blank from binding to receptors at the neuromuscular junction. The answer is acetylcholine. Question number 2. Succinylcholine can cause blank, which is a rare life-threatening condition characterized by a high fever and muscle rigidity. The answer is malignant hyperthermia. And question number 3. Which skeletal muscle relaxant should be administered to patients experiencing malignant hyperthermia? The answer is dantrolene. All right, that's it for this video. I hope it was helpful. If so, be sure to hit that like button, Take care and good luck with studying. We invite you to subscribe to our channel and share a link with your classmates and friends in nursing school. And if you found value in this video, be sure to hit that like button and let us know what you found to be particularly helpful.